Hey everyone, I just want to thank you for tuning in. This is Dr. Sean Palmer here at Aspen Creek Naturopathic Clinic here in Laramie, Wyoming. Now, did you ever want to be able to do more to be able to take care or take control of your own health? If so, this talk is going to be for you. What I'm doing is a short YouTube series on addressing everyday injuries and homeopathic remedies that you might want to have at home to help both the pain associated with those injuries, along with trying to help stimulate healing and repair from those injuries. I'm focusing on homeopathics because this is one of the safest forms of medicine you can do. It's great for children, it's great for older adults. My goal is to give you options on how to address your own health and the health of your family, and also let you start managing more of your problems on your own without needing the care of a professional. Now, although the remedies in this series are meant for acute injuries, listen carefully because some of them can also sometimes be used in some chronic situations. So with that, let's get into it. So the rest of this particular video is going to focus on a remedy called Arnica. Now, Arnica is the most common homeopathic remedy to find in any shop that sells supplements. And this is one of the main ones this is one of the main ones you want to make sure you have at home. It's also your first go-to for most injuries. And so when in doubt, if you get hurt, maybe try Arnica, especially as close as you can right after the injury occurs. And as I said before, in terms of what you use it for, this is a first-line injury remedy. But there are actually some specific indications that even people who may have heard of Arnica before may not. I find a lot of clients don't always know for sure what all it's used for. And the more specific circumstances where Arnica works best. And so what I want you to do is I want you to stop for a minute and think about what you might have experienced, say, right after maybe slipping and falling onto the ground, or say you actually ran into like your shoulder or some body part ran into like, say, the corner of a door. And so if you kind of think about what you experienced in that moment, especially after you get over that first initial shock of knowing you just hurt yourself, you might start to, like, either right away or within a few hours, you start feeling like a sense of achy soreness. It might be kind of intense initially, or it might not be. But think about what that sense of achy soreness feels like in that moment. And then also later, you might notice how your body changes, like how you start developing bruises and the appearance of a bruise. And the particular bruise appearance that Arnica is famous for is in this first picture that I'm circling. So it's kind of that more brighter, more dramatic bruise. As the bruises develop, you're going to start moving to other kinds of remedies. But anyway, so Arnica is one of its best uses is for like blunt trauma from a fall or something from like being hit like by a baseball bat that causes you to feel sore. And later, you may start to again develop a bright purple bruise. Now, if you experience any of those things after an injury, Arnica, like the achiness or the bright bruising, Arnica is likely going to be your first go-to, whether that's you hit your head, whether that is, could even be like after surgery, that could even be you went and had a dental cleaning done, and maybe your mouth feels kind of sore and achy after having visited the dentist. And so, those kind of give you some examples of how sometimes we think a lot outside the box about a homeopathic remedy, and what you're looking for is kind of that experience that you have after some kind of injury and where your body's telling you needs to happen. As I also listed here, Arnica is used for muscle injuries. So, a lot of times after someone had slipped and if you had slipped and fell onto, say, the sidewalk, the first thing that oftentimes will hit will probably be actually muscle, just because most of your body has muscle over the bones and everything else like that. And so Arnica is kind of known for helping repair muscles. So there are some other examples of where sometimes you might feel sore and achy because of a muscle injury. Probably the biggest one is just when you overdo it exercising. So let's say you're getting to a new workout and maybe you're weightlifting for the first time and you feel sore after that. That could be an example of an Arnica or need for Arnica. Also, if you say you do a long ski, a long hike, a marathon. And so you can also use it for that kind of those overdoing it circumstances. Now, how do we use Arnica? There's a couple different ways that Arnica can be applied. One is you can do it topically. There are a number of commercial companies that make either a Arnica cream, standalone Arnica cream, or Arnica mixed with other homeopathics. Either one of those things could work fine. If you do that, you want to apply it directly to the area of injury, as long as you don't have any open skin. So as long as there's not a cut or something that you're going to be putting the cream into. But yeah, so you can do it topically. You can also do it orally. So you can do it as in the form of a pill. Either one works fine. Doesn't matter which way you do it. The main thing with the Arnica is paying attention to how often you do it. And how often you do it depends on the strength. So Arnica, all homeopathics come in different strengths. A low strength could be what's called a 6X or 6C. A middle strength could be a 12C, and a higher strength, a commercially available higher strength, might be a 30C. And so if you do a low strength, like a 6C, then you might do that up to 4 or 5 times a day. If you do a higher strength, like a 30C, you might just do that once that day. And that also goes the same with the cream. Most creams will be low strength, which means you'll want to apply it multiple times throughout the day, probably at least 3 to 5 times that day if you can, right after an injury. Now, the thing to pay attention to is the way you prescribe a homeopathic remedy. You also pay attention to how someone's responding to it. And so if you are, so let's say you take the remedy and you immediately feel better, then you don't redose until you notice like the pain is starting to come back again. And so again, with the example of the 30C, let's say we gave you took a 30C in the morning, and then you notice your pain goes away for about say 5 or 8 hours. Then maybe at the 8-hour mark, you do it again. Or if you notice you're good for 3 or 4 days, then you wait 3 or 4 days before you take it. So pay also attention to how you're responding and use your body in part to be your guide as to when you redose. Now, if you're not noticing any immediate improvements, which not everybody will notice an immediate improvement even with the right homeopathic, then kind of just go off of the previous instructions I said in terms of just doing a standard 1 to 4 times a day based on the strength of the Arnica you have. Now, one of the great things about all homeopathics is that they pair well with any medication, supplements, and or herbs. So you don't need to worry about avoiding Arnica or avoiding taking Arnica if you're on any particularly sensitive medications. As I also stated earlier, it's great for children. It's great for also senior citizens. It's usually actually pretty hard to hurt people with homeopathics. It's considered probably one of the safest forms of medicine you can practice. Having said that, though, there's no form of medicine I can guarantee is 100% side effect free. And so because of that, although side effects are usually very rare, and if they do occur, usually mild, if one should occur, then probably what you'll want to do is to try discontinuing the homeopathic remedy. And usually within a day to 3 days, you should notice that that side effect should dissipate. If it's not, then usually that's a sign that there's something else occurring besides a side effect to the remedy. So that is Arnica, both the reasons why you'd use it and also how you would use it. In the near future, I'm planning on covering additional homeopathic remedies, of which Arnica is only one that can be helpful for pain. And one of my main focuses in my clinic is helping people with pain, especially more unusual pain circumstances. So if that should happen to be you and you have something that's beyond the scope of a particular talk, I'd certainly be happy to have a visit with you. In the meantime, I just want to thank you for tuning in this talk. And again, since there'll be more talks, I invite you to tune into those also. So thank you again.